Welcome back to our channel. Today, we're diving into an important topic that affects many of us. Medications that can harm your kidneys. You see them on the shelves every day at the pharmacy, even advertised on TV. These are medications that many of us take without a second thought. But what we don't realize is that some of these seemingly harmless drugs could be silently damaging our kidneys. Stay tuned to find out which common drugs you should be cautious about and how to protect yourself. Trust me, you don't want to miss this. You don't want. Let's kick things off with a medication many of us reach for at the first sign of a headache or muscle pain: ibuprofen, often sold under brand names like Advil or Motrin. It's a staple in many households and medicine cabinets, providing quick relief from various types of pain. Now, ibuprofen is generally safe for short-term use. But did you know that prolonged or excessive use can potentially harm your kidneys? This is something many people are unaware of, and it's important to understand the risks involved. Here's the deal. Ibuprofen belongs to a class of drugs called NSAIDs, or non-steroidal anti-inflammatory drugs. These medications are widely used and trusted for their effectiveness in reducing pain and inflammation. NSAIDs work by reducing hormones that cause pain and inflammation. These hormones, known as prostaglandins, are responsible for the pain and swelling you feel when you have an injury or inflammation. However, these same hormones also play a crucial role in maintaining blood flow to your kidneys. Prostaglandins help to ensure that your kidneys receive an adequate supply of blood, which is essential for their proper function. When you take ibuprofen frequently or in high doses, it can restrict blood flow to your kidneys, putting extra stress on these vital organs. This reduced blood flow can lead to kidney damage over time, especially if you already have underlying kidney issues. Over time, this can lead to a condition called analgesic nephropathy, a type of kidney damage caused by painkiller overuse. This condition can be serious and may result in chronic kidney disease or even kidney failure if not addressed. Now, I don't want to scare you off ibuprofen entirely. It's an effective pain reliever when used correctly, and can be a lifesaver for those dealing with acute pain. It's an effective pain reliever when used correctly. The key is to use it responsibly and be aware of the potential risks. However, it's crucial to be mindful of your ibuprofen intake, especially if you have pre-existing kidney conditions or are taking it long-term. Always read the label and follow the recommended dosage instructions to avoid any adverse effects. Always follow the recommended dosage instructions and talk to your doctor if you have any concerns. Your healthcare provider can offer guidance on safe usage and alternative pain management options if needed. Remember, your kidneys work hard to keep you healthy, so let's treat them with care. By being informed and cautious, you can continue to use ibuprofen effectively without compromising your kidney health. Next up, we're talking about naproxen, another common pain reliever that many people turn to for relief from various types of pain. It's often sold under brand names like Aleve, which you might have seen on store shelves or in advertisements. Like ibuprofen, naproxen is an NSAID, or non-steroidal anti-inflammatory drug, and it carries similar risks to your kidneys, especially with long-term use. Naproxen is often marketed for its longer-lasting pain relief compared to ibuprofen, which can be a significant advantage for those dealing with chronic pain conditions. While this extended relief can be beneficial for managing chronic pain, it also means that naproxen stays in your system longer, potentially increasing the risk of kidney damage with prolonged use. Studies have shown that long-term use of naproxen can lead to various kidney problems, including acute kidney injury, chronic kidney disease, and even kidney failure in severe cases. In severe cases, this can escalate to kidney failure, requiring treatments like dialysis, which can significantly impact a person's quality of life. These risks are particularly elevated in individuals with pre-existing kidney conditions, diabetes, or heart disease, making it crucial for these patients to be especially cautious. So, what's the takeaway here? It's important to weigh the benefits and risks of using naproxen, especially if you have underlying health conditions. While naproxen can be an effective pain reliever, it's crucial to use it cautiously and under the guidance of your healthcare provider to minimize potential risks. Don't hesitate to discuss alternative pain management options with your doctor. especially if you have any risk factors for kidney disease or other health concerns. Remember, your health is a marathon, not a sprint, and making informed choices about your medications is crucial for long-term well-being. Always prioritize open communication with your healthcare provider to ensure the best outcomes for your health. Now let's shift gears and talk about a class of medications commonly prescribed for high blood pressure and heart failure: ACE inhibitors. These medications are a cornerstone in the treatment of cardiovascular conditions and have been life-saving for many patients. These medications, with names often ending in pril like lisinopril or enalapril, work by relaxing blood vessels to improve blood flow and lower blood pressure. By inhibiting the enzyme that produces angiotensin II, a substance that narrows blood vessels, they help to ease the workload on the heart. While ACE inhibitors are generally safe and effective for most people, they can pose risks to individuals with certain kidney conditions. It's important to understand that not all patients will experience these side effects, but those with pre-existing kidney issues need to be particularly cautious. You see, ACE inhibitors work by affecting the renin-angiotensin-aldosterone system, which plays a vital role in regulating blood pressure and fluid balance in the body. This system is complex and involves multiple organs, including the kidneys, which are crucial for filtering blood and maintaining fluid balance. In some cases, particularly in people with pre-existing kidney disease or those with narrowed arteries supplying blood to the kidneys, ACE inhibitors can further reduce blood flow to the kidneys, leading to kidney damage. This can result in a decrease in kidney function, which may necessitate adjustments in medication or additional treatments. It's crucial to be aware of this potential side effect, especially if you have any underlying kidney issues. Open communication with your healthcare provider is essential to ensure that your treatment plan is safe and effective. Regular monitoring of kidney function through blood tests is essential for anyone taking ACE inhibitors long-term. These tests help to catch any potential issues early, allowing for timely intervention and adjustments to your treatment plan to maintain optimal health. Moving on, let's discuss a class of medications that many people rely on for heartburn and acid reflux proton pump inhibitors, or PPIs. These medications, with names often ending in prozole like omeprazole or lansoprazole, work by reducing the amount of acid your stomach produces. While PPIs are highly effective in treating acid-related conditions, recent studies have suggested a potential link between long-term PPI use and an increased risk of kidney problems. One study published in the Journal of the American Society of Nephrology found that people who used PPIs for an extended period were more likely to develop chronic kidney disease compared to those who didn't use these medications. The exact mechanism by which PPIs might affect kidney health is still being investigated, but some researchers believe it could be related to changes in blood flow to the kidneys or inflammation. Next up, let's talk about diuretics, also known as water pills. These medications work by helping your kidneys remove excess water and salt from your body, which can be helpful in treating high blood pressure, heart failure, and fluid retention. While diuretics are generally safe and effective, it's essential to use them cautiously, as they can sometimes lead to dehydration, electrolyte imbalances, and even kidney problems if not used correctly. One way diuretics can potentially harm your kidneys is by causing dehydration. When your body becomes dehydrated, your blood volume decreases, which can reduce blood flow to your kidneys, putting them at risk of damage. Another concern with diuretic use is the potential for electrolyte imbalances. Diuretics work by flushing out excess water and salt, but they can also deplete your body of essential minerals like potassium, magnesium, and calcium. Let's now discuss lithium, a medication commonly prescribed for bipolar disorder and other mental health conditions. Lithium works by stabilizing mood swings and reducing the severity and frequency of manic episodes. While lithium can be a life-changing medication for many people with bipolar disorder, it's crucial to be aware of its potential side effects, including the risk of kidney damage with long-term use. Lithium is primarily processed by the kidneys, and over time, it can put a strain on these vital organs. Long-term lithium use has been associated with an increased risk of chronic kidney disease and, in some cases, kidney failure. The good news is that the risk of lithium-induced kidney damage can be significantly reduced with careful monitoring and management. Regular blood tests to check lithium levels and kidney function are essential for anyone taking this medication. Finally, let's talk about antibiotics, a class of medications used to treat bacterial infections. While antibiotics are essential for fighting off potentially life-threatening infections, some types of antibiotics can be hard on your kidneys. One group of antibiotics known to pose a higher risk to kidney health is aminoglycosides such as gentamicin and tobramycin. These antibiotics are potent but can be toxic to the kidneys, especially when used in high doses or for prolonged periods. Another type of antibiotic that can potentially harm your kidneys is vancomycin, often used to treat serious infections like MRSA. Vancomycin is a powerful antibiotic, but it can also cause kidney damage, especially in people with pre-existing kidney disease, or those taking other medications that can harm the kidneys. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health tips and information. Remember, knowledge is power when it comes to your health. By being informed about the potential side effects of common medications, you can make more informed decisions about your health and work with your doctor to minimize risks. Take care of your kidneys and stay healthy.